So we are talking about the main factors, right?
Yes.
The main causes of infertility, if you remember.
Yes.
Main factor. So for main factors, I mentioned some basic factors. So what are the factors I mentioned earlier? I made mention of which syndrome? Doctor? Klinefelter syndrome. Okay. So, and I told you how to ask it. I won't go over that again. I made mention of TB. Apart from TB, what other things? I made mention of mumps, infections. Dr. Tolu said infections. So I talked about the STIs, the gonorrhea, and the rest. STIs, even otitis, mumps otitis. Okay, and what other things? We talked about erectile dysfunction.
Okay, awesome.
So for erectile dysfunction, I told you how to ask erectile dysfunction. How do you ask erectile dysfunction? Doctor?
Is your husband having difficulty maintaining erection?
Very good, perfect. Is your husband having difficulties in maintaining erection? Apart from that, what other causes and what other thing? The last one I said was drugs. So what drugs can cause infertility? What drugs? Drugs of illicit, some illicit drug like cocaine, like all this marijuana. Do you understand? Cocaine. You want to ask if the patient is taking cocaine, okay? You want to ask about things like marijuana. Marijuana. Okay, you want to ask about that. And apart from that, there's some pharmaceutical drugs like the spironolactone. It's also proven to cause infertility also. You know spironolactone now, this is your potassium sparing diuretics.
Yeah, true.
Spironolactone. It's also known to cause what's it called? Infertility. And there are other drugs, or even cimetidine. You know your cimetidine, your H2 receptor blockers. You remember cimetidine now?
Yes. For ulcers.
Yeah, they used to treat ulcers. Cimetidine is H2. That's on the H2 receptors. It's H2 receptor blockers. Even your beta blockers. Beta blocker is also believed to cause infertility. Alcohol. This alcohol causes a lot of things. I have not canceled alcohol with everybody before, right?
No.
Okay.
No.
Alcohol also causes infertility. It's one of those things that causes infertility also. Apart from that, for men, stress is general. Stress causes infertility. And somebody said something about surgery the other time. Now you can start talking about surgery. If somebody has done all this, what's it called? Prostate surgery before, you understand? If you have done prostate surgery before, let's say prostate surgery, okay, it can cause it also. Even your smoking, cigarette smoking can cause infertility when you smoke cigarette. And what other thing, doctor, please?
Occupation.
Occupation. If you are somebody that exposes yourself to radiations all the time, you can actually have possibility of having infertility. And apart from that, what other thing, doctor? What other thing? Even people that wear tight trousers, tight clothing. If you wear tight clothing, underwears. So some men are actually used to it. They wear tight boxers or tight clothing. Let's say clothing. Okay, tight clothing like your underwears. So it's something you have to advise either your boyfriend or your boyfriend or your husband in future. If you don't marry to a doctor, you have to advise them not to wear tight clothing. So it's also predisposed to having this thing. Even DM, diabetes, and so on, diabetes. So these are main factors that can cause infertility. You are welcome, Dr. MK Adebisi. We started. It's been
Thank
a while we started.
Much, Dr.
We really.
Yes, I know.
I don't know why you said.
I'm still at the lawyer's office, but I can't miss the class.
It's all right. So what we are discussing about is we are clerking infertility, the gynecological clerking. So we are clerking infertility. We've analyzed the symptoms of infertility. I think some people made a screenshot. I'll actually make a record of it. I'll send it to you personally. And also, there's also, what's it called? We've analyzed the symptoms. We talk about the female factors of infertility. And we are talking about female factor and male factor now, because I said earlier, for infertility is not dependent on one person. You understand? It's both of them. So previously, we live in an environment where when they say the person is infertile, they only look at the woman. No. Also, the man also play a major role in infertility. So these are some of the few that we mentioned. Even UTIs, don't forget, UTIs is also one of the causes. UTIs. Not just only STIs alone. UTIs also. Urinary tract infection can also cause infertility. Understand, doctor? So let's continue. So don't forget the rules, the 5 C's. After you analyze the symptoms, you analyze the causes. The next thing is the complication. So what are the complications of infertility? What can it result into? What are the complications of infertility? Complications. And doctors?
Psychological depression.
Thank you very much. It can cause depression. You are correct, Dr. Adebisi. It can cause depression. Before you know, you see the woman cannot even do anything again. It can cause depression. And when the woman is depressed, there will be a lot of problem, marital issues, disharmony. Let's say marital disharmony. Yeah. Marital issues. Before you know, or let's say disharmony or anyone, marital issues. And apart from that also, you hear pressure from, before you know, there will be pressure from the in-laws. You doctors, you know this environment where we live in now. For those of you that are abroad, it might be different, but if you come here, you've all lived here before, all of you, and you know it's a different thing. There will be pressure from the in-laws. Pressures. Before you know, they can even force the man to go and marry another person. Pressure from in-laws. Okay, so these are the in-laws. So these are this thing. Apart from that, what other thing? What do you think? What kind of complication can arise?
Could cervical cancer be a complication?
Not really, doctor. Not based on this concept. Not like real complications that can happen. Low self-esteem. The human can look at itself low self-esteem.
Low self-esteem.
Do you understand?
Suicide.
Suicidal thoughts. People begin to have suicidal thoughts. Low self-esteem. Okay? Apart from low self-esteem, you begin to have different thoughts. Even the person don't even want to go to a gathering again where there's a lot of people. You begin to have anxiety. Let's say anxiety. Do you understand? Anxiety. They begin to have anxiety, begin to have suicidal thoughts. Once anxiety is there, you have suicidal thoughts. You understand? Even at that time, the sexual drive will be low. The sexual drive will become low. The person doesn't even want to have sex again. Do you understand? There is low sexual drive. Let's say low sexual drive. Do you understand? And apart from that, also the person will begin to avoid in Nigeria here. Before you go out, you'll just point finger at you like, that is so and so person. No. Do you know how many years she has gotten married? Nothing. Do you understand? So the person will avoidance. Let's avoidance.
Environment.
Yeah, avoidance of public gathering. Let's say. Do you understand? Avoidance of public gathering. So there are other causes of infertility. Do you understand? A lot. And there are several complications. But in summary, this is enough. This is enough. Doctors, it's only Dr. MK that is with us. Now that Dr. MK is here, all other doctors muted their own audio.
With you.
We are here. Hello. Good morning, sir. How are you doing today? Good.
All right, so doctor, let's continue then. So at this point, please, do you have any question? Can we continue?
Yes.
Dr. MK, where's your friend?
Sir.
It's like that your friend messaged me.
She texted you. Okay.
Yeah.
I don't know. I told you I'm not sure about.
She texted me that day and she said she's interested, and I'm like, okay, you can join or something. And I didn't hear anything back from her ever since that time.
I'll give her a call later in the evening and pressure
right.
her to download it. She's a lazy kind of person, actually.
MDCN, you don't have to be lazy of
She has
MDCN.
finished medicine. She didn't pass the first one. I think that's why she gave up
I really
like
understand.
that so easy.
I understand that feeling. You know, the problem is in medicine generally, once you fail first time, it's difficult for you to pass the second time. You know why? You are depressed. Even the urge to study decreases. Do you understand? So it takes extra strength. It takes God grace. I understand. I really understand. It takes God grace for you to sit down. That is medicine in general. Even in medical school, once you fail one exam, so even to study, everything like you are weakened, you are depressed. Do you understand what I'm saying, doctor? So you can do your own part, Dr. Adebisi, by encouraging her, by supporting her, and by praying for her. It's not that she's lazy. I understand the drill, and it's not easy. It's just God's grace, doctor. Okay? So let's continue.
Yes, sir.
So talking about the complications, what other thing we want to talk about is the caregiving. We want to ask the person, what have you done so far? Have you been to any herbalist home? Have you taken any herbal concussion? Have you done any karyotyping? Have you, caregiving so far? Caregiving. So you want to ask, what have you done so far? Somebody who has not been able to conceive, you have done something. What have you done so far? You understand? How many prayer houses have you visited? You have to ask it. Is it real? People go to prayer house, and in all this prayer house, they do a lot of funny stuff. You understand, doctors? They do a lot of funny stuff. How many affairs have you visited? How many church have you been to? You want to know. Have they done any ritual? Have they done anything on you? Do you understand? Because people do funny stuff. They can even be asking them to drink what is not real. We live in an environment where some superstition belief is actually taking, like different things are taking place. So you have to ask. So how many, let's say prayer house? How many prayer house? Or let's say imams or anything. I don't know. Have you visited? You want to ask the patient about that. Okay? And apart from that, you want to ask if the patient have been to any hospital. Have you done any karyotyping? Karyotyping is one thing that you should do. You understand? Have you done any karyotyping? You understand? Or any genetic testing? Any genetic testing. You want to ask the patient about that. Okay? So you want to ask all these things. Have you done any semen analysis? You have to ask the husband. If he's a man, or you have to have your husband done any semen analysis. And by the way,
sorry to interrupt you, Dr. Bob. I have a question.
All right.
Because it's actually one of my friends just told me about it today. Like there is a range for the analysis of semen.
I will teach you guys. I'm going to explain how to analyze semen analysis. It's one of those things. It's one of those topics I will teach. You understand? It's very easy. It's very simple. You have to be able to analyze semen analysis. We are going to discuss it in proper. We are going to talk about the morphology, how you know if the morphology is affected. Do you understand what I mean? You have to know about the morphology if it is affected. Doctor, please. Hold on. Give me some seconds. Give me some seconds, please.
Welcome back.
Thank you. So you want to ask about this? As I was saying, I will explain semen analysis. I will explain how you check for the motility, the values, the normal value, how to check for the morphology, what is when the morphology is affected, the thing you call it, when there's low sperm count, everything we are going to do it. Okay? We are going to take time and do that. All right, doctors? So
okay.
Don't worry, Dr. MK. I will take my time and I will do that. I will treat that with us. It's one of those cases you might actually in one of those stations. You might be given to analyze the semen analysis. So it's something you should know very well. Even generally in the hospital, you'll be given semen analysis. You should be able to conclude like, oh, this person is having leukocytospermia. You should be able to say, oh, this is oligospermia. This is astenotospermia, and astenotospermia. You should be able to know, you should be able to conclude. All right, doctor. So let's continue.
Yes.
Please, let's continue. Yeah. So Another thing is, after talking about the, even for the women, for the causes, Sheehan syndrome, I just remember Sheehan syndrome is also one major causes. It can cause infertility. So you have to ask about, in previous pregnancy, do the person have excessive bleeding in previous pregnancy, or if she ever had before? You understand? You have to ask about excessive blood loss or bleeding in previous pregnancy. It's very important. So haven't you asked about all these things? You want to go to gynecological and obstetric history. And at this point, I expect some of you doctors, you know all these things very well. How to ask for the obstetrics and gynecological history. It's just the normal routine. Okay? So let's start with the gynae history. I prefer gynae before obstetrics. So let's start with the gynae history. This is a woman. So for the gynae history, what do you want to ask? You want to ask about the menarche. Menarche.
LMP.
Eh?
Last menstrual period.
No, doctor. This is different. This is different. I'm not talking about reproductive profile, please. This is gynecological history.
But since in Gyni history, I think I thought LMP
doctor,
was also like.
It's not. For the beginning, in the beginning, you already asked LMP. I did that before at the beginning, and I explained before.
Okay.
After you ask your biodata, you ask for your reproductive profile, you ask for your LMP. So here you want to ask gynae history.
For the history, cycle.
Yeah, you want to ask about menarche. So how do you ask about menarche? You want to ask when was it? How old were you when you first see your menstrual period, your first menstrual period? You understand? How old are you when you first saw your Wait, there's some noise coming from somewhere. Is it from which? Okay. Menstrual period. Okay. How old are you when you first saw your menstruation? You can ask it like that. Okay. So please, doctor, can you all hear me?
Yes.
Yes.
Oh. All right, let's continue. So there's some noise. There's some noise. Somebody is saying something. I don't understand. Somebody just typed something. Kata. I don't understand. What do you mean by kata, doctor?
Maybe it means katamina.
Katamina.
What do you mean by katamina? I don't understand, doctor.
Katamina, like the breast development.
No.
The secondary sexual
doctor,
drive development.
Yeah, I understand, but there's some major point you need to ask here. You don't spend your time asking this one. There's some major thing you need to ask on gynae history. There's a scheme you have to follow for gynae history, for your gynae and for your obstetric history. Do you understand? So after asking for the menarche, you want to ask how long does the cycle? How long does your flow last?
I'm not in Nigeria, so I want to.
So this is Nigeria actually. Okay, you want to know how long does your flow last? How long does your flow last? So for this one, there's some noise coming from some. Okay, all right. How long does your flow last? Do you understand, doctor? You want to ask about how long is Dr. Tolu still with us here? Please, I want to be sure. Dr. Tolu, are you with us? Dr. Tolu?
Yes, I'm here.
All right. You want to ask how long does your flow last? You want to ask, and you want to ask it in example. Is it after 2 to 3 days? Is it 2? Is it 3 to 4 days or more? You want to ask. You understand? Then after asking, you want to ask about the length of the cycle. How long does your cycle last? How long does your cycle last? You understand? You want to know how long is your cycle? The cycle comes, does it comes after every 28 days or more, or probably less or less? You want to know.
Now,
You understand?
Somebody's
my
background is
first
noisy.
name
Yeah,
is
it's Dr. Adebisi background. I've muted this audio for now. So you want to know how long does the cycle last? Does it come after every 28 days or after or is more than that or is less than that? Do you understand? It's very important. All these questions I'm telling you. Please take note. And when you're asking them, you can ask them with the example so the patient can understand and the examiner can understand what you're saying. It's very, very important. So after asking about there's a noise coming up again. I think that is Dr. Aisha's background. Okay. Somebody that is the side is not noisy could always on their audio. So everything shouldn't just be silent as if I'm talking to myself alone. That your side is not noisy. So Dr. Gift, I believe your side is not noisy. Even Dr. Tulu, I believe your side is not noisy. Okay, very good. Yeah. So you want to know how long does your cycle last? Does this come after every 28 days or less or more? So after asking about the length of the cycle, you want to ask about any pain during this period, any dysmenorrhea. Do you understand? Do you have pain during your menstruation? It's very important. You want to know if the patient have pain. Do you have pain during menstruation? You want to know. You understand? You want to ask if there's pain during menstruation. And apart from pain during menstruation also, you also want to ask previous history of any drug, any OCPs taken, any oral contraceptive drug taken. Do you understand, doctors? I believe you are all with us. Hello.
Yes.
All right. Is Dr. Tulu still with us? Hello, Dr.
yeah,
Tulu.
which is Dr.
Yes, I'm here. Yes, I'm
All
here.
right.
I
All
just
right.
muted myself.
Okay. You want to ask about pain during menstruation. It's very important for you to ask. Okay. So you want to know if the patient have pain during menstruation. And apart from that, you want to ask about previous history of any contraceptive drugs. You want to ask, do any previous history, any previous history of contraception or contraceptives uses? You understand? And apart from that also, you also want to ask.
Print, I see.
Dr. Adebisi, please, your side is actually making noise. I don't know, your background is very noisy. That was why I actually muted your audio. Do you understand? It was actually noisy. That was why I muted it. So you want to ask any previous history of contraceptive use, and do you have any pain during menstruation? You understand? You want to ask about the cycle. You want to ask about the length of the cycle. Do you understand? So after hold on, doctor. Hold on, please. Hold on. Hello, doctors. Yeah,
Hello.
can you all hear me?
Yes.
All right, let's continue, doctors. Please, if your background will be noisy, you can always mute. That was why I muted you, Dr. Adebisi, please. All right, so let's continue. Sorry for the distraction. So for the after you asked about the menstruation, you asked about any previous history of any contraception. You want to ask about any history of abortion done, if the patient has done any abortion before. Any history of abortion done. Okay? It's very important to ask for history of abortion done. Okay? And apart from that, also after the history of abortion done, you also want to know if the patient has done any Pap smear. Pap smear. You have to explain what is Pap smear. You have to tell the patient, have they taken any smear, anything from your vagina just for examination for cervical cancer before? So in summary, once you are clerking, this is enough for your gynae history. Am I making a point? Am I making sense to everyone here?
Yes.
Okay. So after gynae history, another thing you want to do is to ask about the what? The obstetric history. So what do you ask for in obstetric history? So for Obs history. So you want to ask about the previous pregnancy. You want to ask about the previous pregnancy, previous pregnancy, the outcome of the previous pregnancy. Do you understand? You want to ask about how was the pregnancy? Was there any complication? You want to ask how long does the person stay in the hospital even after the delivery? You want to ask, was there any complication? How was the delivery achieved? Was it vaginally? Was it through cesarean section? You understand? If it is C-section or if it is vaginal delivery. You understand? And after asking that, you also want to ask about any family history of twinning. You even want to ask and know the weight of the baby after delivery, if the woman can remember. You want to ask how long does the woman stay in the hospital? So these are some of the questions you want to ask from Obs history. So let's start. How you ask about how was the previous pregnancy? You ask about that. How was it achieved? How was it achieved? Was it vagina delivery or through CS, cesarean section? You understand? And apart from that also, you also want to ask, how was there any complication post-delivery? Was there any complication? Was there any, well, this thing is not typing again. Was there any complication after delivery? Okay? Then apart from complication also, you also want to ask, after delivery, how long do you stay in the hospital? How long do you stay in the hospital after delivery? Do you understand? You want to ask the weight of the baby. Do you remember the weight of the baby after delivery? You understand? And also you want to ask, was the baby forced to cry, or does it cry on its own? Or does the baby cry on his or her own? And don't forget, you also want to know the sex of the baby. The sex of the baby is very important to ask also. It's one of those gynecological things. Then you want to ask about any family history of twinning. Any family history of twin. You understand? You want to ask the patient. So in summary, these are the basic things you want to ask from the patient once you are taking gynecological history. Then after this, other things are the same thing. Then you now move to your previous medical history. And for previous medical history, I already taught us how to do previous medical history. There's an acronym we use. We all remember the acronyms we use for previous medical history. You all remember the acronyms we use for previous medical history in our doctors. For previous medical history, there's an acronyms. Do we still remember the acronyms? Doctor, why are we not responding to me?
No, I can't remember.
Previous medical history.
Sade.
Shade.
Yeah, that's true.
Yeah, there's an acronym. The acronym is Shade. And I told you S stands for what?
Sickle cell.
Yeah, if the person is sickler, you want to ask. And H stands for what?
Hypertension.
Hypertension. And A stands for what?
Asthma.
And D stands for what?
Diabetes mellitus.
E stands for what?
Epilepsy.
Epilepsy. Am I correct with my spelling? No. Hold on. Epilepsy. I hope I'm correct like that. Doctors, are you all with me?
Yes.
Yes.
Okay. So these are the things you want to ask. And apart from that, also you want to ask about any surgery done, any history of surgery. These are basic things that we used to do before. This one will always be there. So you have to know all those ending parts. They just add marks. Those are your extra marks. That one you should know it for all gynecological clerking. It's always going to be there. Dr. Tolu, you remember all these things, right?
Yes.
Yeah, all those things will always be there. It's always going to be attached. You understand? Then any history of surgery, any blood transfusion done, any blood transfusion done. You want to know about history of blood transfusion done. Then you move to your drugs. You understand? You ask about drugs history also. You ask about any chronic use of any drug. Chronic use of any drugs, like steroids. You want to ask about that. Any allergy, any drug allergy. You ask about any drug allergy. You understand? You want to ask about drug allergy also. Do you get what I'm saying? So these are the basic
Yeah.
stuff you want to ask. Then from there, you want to go to the family history. Family history. For family history also, it's the same thing. You also use your what?
Shade.
Shade. But in this case, you are referring it to the family. The same thing you ask. Do you understand? Am I making a point? Am I passing a point, please, doctor? So immediately after you are done with your family history, you also want to also ask about the siblings, the total number of siblings, the family tree. You ask about the family tree. Do you understand? So then after you want to go that, you want to go to what? Your social history. These are the basic stuff you always do before. You understand? I've done all these several times. I make a video, especially on just the introduction alone. The social history. You understand? You ask everything on the social history. Alcoholism, occupations. You understand? The work of the husband. You understand? Then you move to what? You move to the systemic review. And for the systemic review, I told you what to ask. For the systemic review, I told you ask 2 symptoms from each case. Am I making a point, please, doctors?
Oh, yes.
I say ask how many symptoms, at least 2 symptoms each from each system. From cardiovascular system, 2 symptoms. From gastrointestinal system, 2 symptoms. From genitourinary, 2 symptoms. From hematological, 2 symptoms. From CNS, 2 symptoms. From endocrine, 2 symptoms. Each has 2 symptoms each. Am I making a point, doctors?
Yes.
So, and at the end of the day, you give your report, but for the exam, you don't have to give report. That's it. You thank your patient. That's all. You move to the next station. So that is infertility clerking in general. Am I making a point? So now,
Yeah.
I know the time is against us, but we are still going to clerk. I hope we are not tired. Or are we tired?
No.
Okay. All right. So we are not tired. That is impressive. I'm good to hear that. I'm impressed to hear that. So before we do that, let me save this video. I can save this video now. I can stop this thing, right? I can stop
Yes.
recording. All right.
Yes.
So we'll just do the clerking, or maybe let me clerk it myself, so all of you can listen to me, so you can have the video. You understand? So let me just clerk it. You understand? So let assume Dr. Gift is my patient. So Dr. Gift, you might not have to answer all my questions. I'll just do it very fast. Okay. Good afternoon, sir. Good afternoon, ma. Maham by name, Anthony. How are you doing today? Madam, for the purpose of this exam, I would like to ask you some few questions regarding your head. Can I proceed, please? Please, I would like to ask you, what is your name? How may I call you, ma? And what's your age? What's your occupation? What do you do for a living? Do you live around this side? And what's your tribe? And what's your religion? I would like to know. Please, I also like to know, please, what's your marital status and what's your level of education? How many children do you have before now? And when was the last time you saw your menstrual period? All right, thank you very much, madam. Madam, it was shown here that you have been trying to conceive for a couple of times now. I would like to know, how long have you been trying to conceive? And do you actually stay with your partner? Do you stay with your husband? And I would also like to ask, how many times do you normally have sexual intercourse every day? Like how many times do you have in a week? I would like to know. And also like to know what kind of sexual intercourse do you have? Do you have a penetrative sexual intercourse? Or is it just anal sex you have, or you have any other sexual orientation? So, madam, immediately after sexual intercourse, do you do any practices like you doubt, you wash yourself vigorously, or you clean up yourself immediately after sexual intercourse? I would like to know what kind of home do you come from? Did your husband, is he from a polygamous family, or this thing? I would like to know. You are the only wife. And apart from that, also, I would also like to ask you, like, have you fathered a child before? Have you also gotten pregnant before now? I would like to know. All right, thank you very much. Please, prior to this time, have you been having any low abdominal pain with any chocolate discharge before? I would like to know. Are you on any other contraceptive pill? Any contraceptive pill you are taking? I would like to know. Please, have you been having any lower abdominal pain with heavy menstruation? I would like to know. Have you noticed that you've been having changes in your voice with any abnormal hair distribution around your body? I would like to know also. Do you also have any fever with any with any vaginal discharge? I would like to know. Have you been diagnosed or treated for any urinary tract infection before, or any STIs? I would like to know. How old are you again? I want to confirm your age. And also, please, I would also like to ask you, in your previous pregnancy, if you ever had any, do you have any history of serious bleeding, like severe bleeding? I'm trying to rule out Sheehan syndrome here. All right, thank you very much, madam. So also, I would also like to ask you some few questions about your husband. Can you describe your husband for me? Is he tall? Does he have any breasts? Like, you notice any breast protruding out of him? Has he been diagnosed of any infection before, gonorrhea or anything like coccitis or something? Has he done any surgery on his penis or prostate surgery before? I would also like to ask you, what kind of underwear does he wear? Does he wear very tight underwears? Or all right, does he take any drug like cocaine?